gang violence, and elderly minor disabled victims of all crime. Over 20 years ago, I founded the Crime Victim Center, literally from a room in my home, and built it to become a multi-million-dollar agency employing 30 full-time staff. I'm a leader, and I bring stakeholders from both sides together, and we solve problems. We've developed and implemented programs that target specific issues, and we've had absolutely remarkable results. We've reduced sex offender recidivism in the county by 75%. Domestic violence arrests are down by 20%. We've helped facilitate the return of over $6 million to crime victims and educated nearly 200,000 children and adults. And I'm dedicated. When Albany attorneys told me I couldn't pass certain laws, I went to law school at night for 5 years while working full-time to learn how to pass those laws. And I graduated top of my class because I am dedicated. I have nearly 25 years experience drafting and helping pass legislation on a local, county, state, and federal level. I also developed the county's problem-solving court training series in the Family Violence Task Force to provide law enforcement and other stakeholders with the knowledge to steer folks into problem-solving courts. I'm a fighter, a leader, and I'm dedicated. My 25-year track record is evidence that I've delivered for Suffolk. I'd be honored to fight for you and for your rich 375-year history in Albany.
Thank you, Laura. Nora Higgins, I'll invite you to go next.
Yes, hi. Thank you for having me. Again, just to give you a little background, I'm a native to Long Island. I graduated from Comac North, and I then went to SUNY Alfred and got my associate's degree in nursing. Went to Stony Brook Hospital in 1988 and worked GYN oncology and obstetrics. In the last 4 years, I've been in the neonatal intensive care unit. About 11 years into Stony Brook, I had an issue with a manager who falsified a document, and I sought out the help of my union, and that matter was resolved rather quickly. And I felt I had to give back, and I became a steward, and then later secretary of the division. At the hospital, I chair the Legislative Action Committee. I've been on the Diversity Committee, and I sit on the Division of Nursing Council. I'm a mother of 4, a stepmom to 4, and a grandmother of 7. To serve my children, I was class mom, was on the PTA, taught them all religion, joined the choir at church and a cantor there still. Was a Boy Scout leader and a Cub Scout leader. And after 11 years of being a single mother, I got remarried in 2015. I was also elected to New York State Public Employees Federation as the regional coordinator, which is like the regional president. For that position, I serve in the capacity of the political action chair on Long Island, the SUNY Labor Management Chair, the Statewide Nurses Committee co-chair. I'm the Sergeant at Arms at my executive board and my e-council. That position also led me to be on the executive board for the Long Island Federation of Labor. And I'm also on their e-council as the secretary. I was recently appointed, or rather elected, to allow, as a board member, the Advancing Local Leadership Opportunities for Women. I sit on the Professional Policy Committee for Healthcare for AFT. I'm the president-elect for the Professional Nursing Association at Suffolk County. And I've been an adjunct professor for the School of Nursing for 20 years as a UUP representative there. So why do I tell you all those things? I just want to let you know I've got bounds of energy. I love helping people, and I'm tired of sitting on the sidelines watching people not getting what they need. And I want to go to Albany and be the voice for labor, for healthcare, and for the common person, which I definitely feel like
that's time.
Sorry.
Yeah. Thanks. Sorry, my mute was getting stuck. Sorry.
Thanks, Nora. Valerie Cartwright.
Thank you. Well, first, thank you, Catherine, and thank you to the South Hill opportunity to be here today to speak about my candidacy and my platform. As many of you know, I'm an elected official. I have been for the past 7 years. 5 of those years, I've been the only Democrat on a board of 7. In terms of my professional background, I'm an educator teaching in a graduate program at St. Joseph's College. I'm also a civil rights attorney. I've spent over 15 years practicing and fighting for the rights of others and protecting those that have been violated and pushing to make change to some of those systemic discriminatory practices that exist exist in our state as well as across our country. For so many important issues, I have marched, I have protested, I have advocated in so many different ways. I've been the voice of the voiceless since I was a young girl in Queens, living with my grandmother and my aunt who did not speak English, and I had to advocate for them with respect to healthcare and all of the other systems that existed at that time. You see, as the daughter of Haitian immigrants, my father who served in the Vietnam, for a country that was not yet his, and a person who decided to select specific areas of law because of the injustices in my community, I truly understand and have experienced firsthand discrimination, racism, both covert and overt. And I will always fight for those that are treated unequally and always fight for those that have been underserved. So I am looking to continue my fight, not only as an elected official, but also as an attorney, and to keep making sure that the people who are treated poorly are, I'm sorry, did you put your hand up, Greg?
No, not yet.
So the people
Now
that
I
are
am.
treated poorly are properly represented. So I am a community leader. I jumped in this race because of my experience and my passion, and I felt that I was uniquely positioned to make large-scale impact, not only to my constituency, but to Eastern Long Island and the state of New York. So
That's time. That's time.
Move forward and hope that you can continue to support me as I continue in this race for state senate. Thank you.
Okay, thank you. And Tommy John Schiavoni.
Good evening, everyone, and thank you to the Southampton Town Democratic Committee and Chairperson Quigley. My name is Tommy John Schiavoni, and I am a councilman in the town of Southampton. I am a lifelong resident of Senate District 1 and the eastern end of Long Island. In fact, I was raised between the forks on the peninsula of North Haven. I remember a time when scallops were $5 a quart when they were in season. I am, as I said, I'm a councilman, and I have extensive governmental experience on various levels. I was a trustee in a village government. I spent time on a school board fighting for educational issues. I've also been on a number of land use boards, and I am proud of my service there. In addition, I was a member of the fire department and an officer there, and was with the rescue squad. So, you know, these things are important. In addition to that, I spent my career as a teacher in Brookhaven town. I lived out here and spent 30 years in the Santa Maria School District. I understand Brookhaven. I actually helped Supervisor Grucci at the time start his youth corps program. Our students participated in that. As a teacher, I taught government, I taught economics, and I bring all of this experience to this run for Senate. My priorities are to secure state aid for public schools. Long Island, for every dollar that we send to Albany, we get less than 80 cents back in services, and that has to get turned around. Environmental initiatives. We must turn this ship around. As a councilman in the town of Southampton, we have done great things to the environment with our partners in Southold. Okay, thank you, and other districts, and I look forward to the questions tonight.
All right, great. Thank you to all of you. All right, I'm gonna just jump right into our first question. As you know, COVID-19 has upended simply everything in our lives. And as you know more than anyone, it has really upended campaigning. So we're curious to know how you and your campaign is positioning yourself to win in this district in a general election. How have you reorganized, and how do you plan to manage your infrastructure and campaigning in order to win in November? And we'll start with Laura.
Hi. So I think winning a campaign starts with being having great policies and positions. But more importantly, it is really important to be able to raise money. I started that not-for-profit organization I spoke about earlier from a room in my home. Every penny that organization has brought in has been a result of us working really hard to fundraise, to bring money in from public-private partnerships, and also to go directly to individuals in government to demonstrate the need that the community has for a service. So it starts out with great fundraising, and I am the candidate who raised the most funds as out of whoever filed a report. I also have a strong, very strong infrastructure because I've been able to raise a lot of money. So I have a solid campaign team, and we have an internship program that is extremely, extremely successful. And also we have paid staff. So we are reaching out to the voters via the telephone. We are reaching out to voters via mail. We're using every means of communication to get to voters, including myself. I'm calling voters pretty regularly, and I'm talking to them because I want to understand what's important to them. And I think in the end, it comes down to who develops the relationships, who works really hard. I started in August.
That's time.
2 years ago, and I have tremendous union support, which are boots on the ground for us.
Thank you, Laura. Nora Higgins. You just have to unmute yourself.
Yeah. Very good. So yeah, so again, I have a lot of experience in things other than campaigning in this regard. So I am very reliant on, and I thank you very much for this setup with forums. So any and all invitations that I'm getting to meet the candidates. I am still currently working as a nurse at the hospital and putting in an extra day a week on the COVID unit. And so I am making sure that I can be on all of these opportunities to reach some of our members throughout our constituents throughout the district. And again, relying on social media, word of mouth, talking with my friends, a lot of physical contact at work, letting people know how they can reach me, what to do to be part of my campaign and to help. So it's very challenging because the usual door knocking type of activity, we kind of got cut very short with that. So again, through the mail, thanking the members that had signed petitions is part of the plan, and like I said, it's going to be mostly word of mouth, and I'm relying on some of my union affiliations as well to help with that.
Valerie Cartright.
Yes, thank you. So it's no secret when I came into this race, I came in late, over 5 months after the first candidate, as Laura just indicated. And it was at a time where the declared candidates had already raised money, secured, various elected official and union support. And I came in with my eyes wide open, understanding that I would have some challenges. I've been able to overcome a lot of those challenges. I have raised money. I have secured union support. I've secured environmental organizational support. I'm the WFP candidate, Working Families Party. And I am working very hard to make sure that my name is recognized broader than the people that already know who I am, particularly on the East End. I do have paid staff. I have volunteers, I have interns that are working with me. Of course, as all of the candidates are doing, we have shifted into a virtual mode every week. I've been hosting some form of a virtual forum. I'm having virtual house parties. I am, sending out mailers, getting ads, writing letters to the editor, doing everything that I need to be doing to get my name out. As a Democrat, I align myself with the Democrats that don't believe in corporate big money. So it's really about grassroots organizing and connecting, which is what I've been doing for quite some time on the town level. And I, didn't take any money from any developers when I ran for town council, and I won't take money from big donors here.
That's time.
Working very hard to meet the grassroots people. Thank you.
All right, great. Tommy John.
Thank you. I'm getting the system down. You know, since COVID-19, this really has rocked our world, as you said, and in many different ways. And these campaigns are one of them. Early on in the COVID-19 pandemic, I suspended my campaigning. I believed it was ethically wrong to send people out door to door, and really, I stopped many of my operations early, including fundraising. I believe that people should be spending their money. If they're going to donate money, they should be donating to food banks, their community institutions, and for goodness sakes, go to the restaurants and buy a takeout meal, because our local businesses are hurting right now. So with that said, I have been using social media to get my word out. I have a large base of name recognition, and people know me, and you know, we are going to do what campaigns do. I'm going to get my message out and my word out. But during this pandemic, as a councilman, I have been focusing on my job as a councilman. I have been working with the institutions in Southampton Town in coordination with Suffolk County and the state of New York to really get the things that people need. We've had to retool government in a way that we haven't done it in 100 years. Oh my goodness, I thought I had 30 more seconds. Thank you.
Yeah, 90 seconds for responses to
Got it.
questions.
No, it's me. Thank you.
Okay, and Skyler Johnson. You should be able to unmute yourself now. No? Okay, yeah. Now try.
There we go. Thank you so much. So, Laura, I agree that policy is really important. I don't, however, agree that fundraising is more important. I just want to say that because I believe that in any good campaign, policy needs to be at the front. It's no secret that I'm young here, and because I'm so young, I'm able to use social media. I'm able to use a lot of these platforms that candidates traditionally shy away from. My campaign has gone viral several times in the last few weeks, where we've reached up over 20 million impressions on one social media engagement, which is unprecedented for a lot of campaigns. Because of that, we're reaching thousands of voters in the district without even needing to spend a single dollar. We've been able to use a lot of platforms that a lot of candidates don't use, and it's really working. I did mention earlier that my age does create a distinction in the race and gets people involved. Because of that, we have a lot of people that are talking about who I am. I'm written up in the newspaper fairly often. I'm just talked about it. And because of that, I'm able to reach a lot of voters quickly. So during this pandemic, transitioning to a virtual campaign was no issue. I also have over 50 volunteers who are going to be actively phone banking to make sure that as many people are reached as possible. Those phone bankers, by the way, also on any call, the first thing they ask is, are you okay, to voters? So we're making sure that people are okay, and we're making sure that we reach them in this election.
Okay, thanks everyone. Heading on to our next question. Healthcare has always been a huge issue for everyone in this country, New York State included, and now even more so. Curious to hear at all the candidates' positions on a single payer Medicare for all healthcare system in New York State. We will start with Nora.
I'm just looking to unmute.
You are
can you hear me? Okay, great. So yeah, as a nurse, I am very, very in favor of having healthcare for all people. And we really need to, I think COVID, unfortunate as it is, I think it's giving us a pause in where monies are going and how monies are being distributed. And I think we need to take advantage of this pause that we're on and entirely revamp the system, because I can tell you personally, there is way too much at the top. You know, in 1973, under Nixon's regime, he had signed on to the Health Maintenance Organization Act, which allowed hospitals to go from being there to care for people for being for profit. And that was the beginning of the end. And that gave people greed and let hospitals become money makers instead of caregivers. And like I said, this is our opportunity now to overhaul that system, and we need to start getting good policies in place to do so.
you, Nora. Valerie Cartwright.
Thank you. So as to healthcare, I wholeheartedly support the New York Health Act. I plan to be a co-sponsor of the bill. I think that healthcare is an absolute right, and we all need affordable, quality, and accessible healthcare. The system clearly is not working, not in the state and not in the country. And I'm a true believer that as state elected officials, we need to understand our responsibility, that when the federal government fails us, we need to step in and make sure that we're filling in those gaps. I think that with COVID, it has highlighted a number of inequities. You see it in the newspapers each and every day, but one of them is with respect to, it's directly correlated to our healthcare. When you look at certain communities that are being impacted, those are the same communities that have more pre-existing conditions, and then those are some of the same communities that do not have access to affordable and quality health care. So I think it's important that we work within the system now and take the examples that are being shown as a result of COVID and utilize that to be able to build a better healthcare system. So I'm hoping that this one good thing that comes out of this COVID period.
Thank you. Tommy John.
Thank you. I believe in the Affordable Care Act. I believe that President Obama had it right. I think that the Affordable Care Act is a perfectly workable program. As far as single-payer health care, I believe we are going there. And I believe that as a nation, that we will eventually be there. But this is not the time to do it. Currently, before COVID, New York was paying $26 billion more into Medicaid than they got back. And that is just, it's not possible for us to fund our own single payer healthcare and pay out to other states to pay into their Medicaid system and their Medicare system. It's not fair to New Yorkers to do that. Now, it's not just all about money to me, but you know what, let's face it, that is incredibly important. I am in a town that has a AAA bond rating, and I believe that if you implement a program, you have to have the funding, secure funding, and a clear, coherent financial plan to implement it. In addition to that, on the school board, we raised our fiscal bond rating from a AA to a AA+. So whatever I do, you can rest assured that there will be the financial plan in place to do it. As far as single payer health care, I believe that we need to do it as a nation. And that is really the way that this is going to happen. I believe that we are going to get there. All other countries major countries in the world have this. Thank you.
Okay, Skyler Johnson, you're next.
Absolutely. So I'm so happy to have this question brought up because, as I said earlier, the New York Health Act has been a priority of mine since day one. I'm endorsed by Long Island activists, which is dedicated to passing this bill. The reason that I know that the bill is affordable and sustainable and workable is because I actually spoke to the sponsor about the bill about it. I spoke to the author of the bill about it, Assemblyman Richard Gottfried. I was in a session with him. We discussed the logistics, we discussed implementation, and we discussed costs. The bill builds on top of existing infrastructure, and that means that it's affordable. I hear the Affordable Care Act mentioned. I agree the Affordable Care Act is workable, but it's not livable. Every day that we do not pass a Medicare for all type plan or a single-payer healthcare plan, people are dying. We have 1 million people before COVID that do not have healthcare in New York, and the rest of those people don't necessarily have quality healthcare. During the pandemic, this is exactly the time to pass it because millions of people are falling off their health insurance. Millions of people are losing their jobs. I will vote to pass this bill because otherwise people die. People around New York State, people around the country are afraid to go to the doctor. Black and brown people cannot take care of themselves because they don't have health insurance. Undocumented immigrants are afraid to walk into hospitals because they're afraid they'll get deported if they do, and they cannot get preventative care. So this is something I'm very passionate about because I will absolutely pass the New York Health Act because every day that we stall, people die.
Thank you, Skyler. Laura Ahearn. Okay, try it now. Yep,
there we go. Yeah. So healthcare, I believe, is a basic human right, and everyone should have access to healthcare, regardless of their immigration status. And COVID highlights the need to rework our healthcare system and to address inequities. But healthcare has to be addressed on a federal level, because if not, we're going to see a migration of folks coming to New York to benefit from our programs, and taxpayers in New York who are already out of work and lost their SALT deduction, and small businesses that are already struggling just to stay alive here in New York will have to pay for that. So in addition, there are folks who negotiated their insurance benefits as part of their entire compensation packages, and we can't just take that away from them. So currently though, 5% of New Yorkers have no health insurance. That's unacceptable. We need to focus on getting that 5% covered and not throwing out the entire system in New York State. So healthcare has to be addressed on a federal level, and I absolutely support expanding Medicaid and Medicare for all that wants it, but we really need to address that 5%.
I was muted, sorry. Thank you all. Moving on to the next question. Cuomo is receiving a lot of positive accolades for his handling of COVID-19 in New York. Even so, there's always room for improvement. If elected, how will you improve upon the New York One response to the pandemic? And we're starting with Valerie.
Thank you. First, I must say that Governor Cuomo has stepped up, as far as has served as an excellent leader, and has been able to calm a lot of our community in a time that we would have never expected. However, I believe that elected officials, state, assembly, and Senate, people are elected into office to always represent their constituency. So if I was your state senator at this point, I would be demanding that I go back to Albany so that we can make sure that the people in our community are being taken care of. The governor has put forth a number of executive orders that have been extremely helpful to our community, but there are so many things that are still outstanding that clearly can only be done by legislation. For example, commercial rent and residential rent. There's no real relief for that. You can't say that you're going to provide an extension of time for evictions, but not provide a remedy for those few months, because once that deadline comes, how is someone who hasn't been raising any money or had any income for 4 or 5 months now have the ability to pay back rent? There's legislation that's currently pending that needs to be addressed. There's legislation that's currently pending now related to small businesses. They're not getting business interruption insurance, as a result of COVID. There's legislation pending, and that's what we need to be fighting for. We need, as elected officials, to be in Albany, even during this COVID pandemic, to be fighting for our community and making sure that they're taken care of appropriately.
Okay, Tommy John Schiavoni, next.
Thank you. Good question. First of all, I have to say that it's nice to see that our governor is stepping up. He's become somewhat of a national figure and a strong Democratic voice in the nation, and people tune into him, and so do I. And I would say that he is doing a capable job as governor. As far as improvements go, I think that we really need to make sure that the banks do not quantize all of the mortgage payments that are not being paid during COVID-19. People who own their homes currently, depending on the bank, they get a break on their mortgage payments. But from what I understand, once that time is up, all of those payments are due. I think that we need to put more regulations on the banks to make sure that people are able to stay in their home. Also, I think that we need to do a better, that we need to take another look at the 4 different steps to opening up. Not all of the things, I believe, are in their proper categories. I asked a question today on the county line regarding museums and art institutions that are currently in the 4th stage of opening up, but they can really do a very good job of getting people into their institutions. That's just a for instance, and get us out of the house and go to one of these institutions where we can socially distance and experience that. Food
That's time.
is incredibly important.
Okay, next is Skyler.
So I agree that Governor Cuomo has done a lot of good during this pandemic. However, there's a lot of things that I would have liked to see changed about his response and the state legislators' response. First of all, I would not have ever voted to cut Medicaid in the middle of a healthcare crisis. Again, I believe that healthcare is a human right. I would have been voting to pass single-payer healthcare and gotten that enacted in New York State, because if we get people back into New York, we're losing a lot of our tax base. That's going to benefit everyone in New York. That's something that I want to say. First of all, no cuts to Medicare or Medicaid. I also would have voted to pass marijuana legalization, or to put that in the budget. Now, I know that a lot of people think that might sound strange. However, if we legalize marijuana, that brings in billions of dollars of revenue for New York State that we desperately need, while a large part of our revenue is gone. And there's a number of other measures to take. And in my limited time, I do want to mention, like Valerie mentioned, rent. We need to see big changes to the way that we're talking about rent and mortgages. Do me a favor, raise your hand right now if you can afford to pay back $12,000 to $20,000 at the end of 3 months because they suspended your mortgage. Yeah, no one's raising their hand for that. That's what they're offering. They're saying, hey, don't worry, if you're having a hard time, just don't pay your mortgage for 3 months, then pay all of it at the end of 3 months. That doesn't make sense. That's gonna bankrupt people. So I would have canceled rent, I would have canceled mortgages, and I would be doing what would be best for New York State.
Okay, Laura?
Okay, there we go.
You're good, we can hear you.
I got it. Yeah, I got it. Sorry about that. So hindsight is 2020. The governor has been in a just an incredible situation guiding us in New York State. However, our most vulnerable in our nursing homes were forgotten. We had epidemics going on in our nursing homes. We had folks that were dying every day. I mean, at one point, half of the deaths in Suffolk County were happening in nursing homes. Peconic Landing was the first sort of first area where we saw a lot of positive COVID cases. So for me, I think I would have changed his response to nursing homes, because there was a directive that required from the Department of Health in New York State that required that the nursing homes, once somebody went into the hospital, even if they were convalescing and they were positive, they were required to take them back. And the nursing homes throughout the state were just not following any of the guidelines, and there was nobody monitoring them. So our most vulnerable were stuck in nursing homes, dying, and their family members couldn't even come into contact with them. So I have a couple of friends that lost loved ones in nursing homes. They couldn't even say goodbye to them. So the handling of the nursing homes is something that I would absolutely change. But now it's time for us all to come together to bring resources to everyone in the state so that they have the PPE so we can open safely.
Okay, Nora Higgins, you just need to unmute yourself. Try one more time. You're still muted. There you go.
Okay. Alrighty. So yeah, it was very helpful for many New Yorkers to be listening to the governor talk every day, and it still is. It offers them comfort. But, and again, everybody's bringing up wonderful points, but if we're not alive to be worrying about any of those things, it's kind of useless. So what I saw as a healthcare professional is that the people on the front line needed to be tested and were turned away. In fact, people who came and waited on the lines at all the different places in Suffolk County and Nassau County who didn't have a temperature or didn't have whatever symptom were turned away. Nobody should have been turned away. We should have made a big effort, you know, again, that goes on to the president, to have gotten ready for this in January. They knew of it in December. We should have started in January, because March should have never happened. We should not have gotten to that surge so quickly. And again, you know, I was waving the flag. Healthcare people, firefighters, police, anybody in constant contact with the public needed to be tested so that those people can convalesce who were sick and the people who were healthy could continue to work. But instead, we left our clean and our dirty laundry in one basket, and we actually, potentiated the spread of disease. So again, I think our focus really needs to be on trimming the spread of disease. If we have a significant, increase in the fall, we're going to be in big trouble.
Thank you, Nora. Okay, our next question. I think we'll still have time for 2 more questions. So, given the strains on the state budget and the unfortunate likelihood of budget cuts if the federal government doesn't come through, what would be your priorities to protect in budget negotiations? And I believe we're starting with Tommy John in that question. Try that again. I think I have to hit unmute first.
Thank you. Can you hear me?
Yep.
We need to get back to a semblance of normalcy, to coin Warren G. Harding's term. And for me, it's education. I want to see that funding in education remains constant. In order for our economy to open, our kids have to go back to school. Our teachers have to go back to work, and the schools, which are the centers of our community, need to be functioning, because schools do a lot more than just classroom education. They provide services, and for me, the education, that would be a top priority of mine. I don't think I have to tell anybody here how important this is, to have parents bring their kids to a place so that they can get back to work. They're sheltering. We're hearing a lot about that. The next area of importance for me would be healthcare. So those 2 things right now in the short term, education and healthcare, would be my priorities. Thank you.
Okay, thanks. Skyler?
So it's funny because a lot of times I feel that this question is, when this question is asked, I don't think that it's discussed in the right manner. We always discuss what programs would you cut first, or what do you not want to see cut. My answer, and I know it's going to sound idealistic, is I wouldn't be cutting programs, and here's why. I mentioned earlier that if we pass marijuana legalization, it brings in money, it actually increases our budget, it gives us more money and more revenue for the state. If we pass New York Health Act, it stimulates our economy, it puts money back into people's pockets that they then can go and spend in New York, and it increases the revenue for New York State. My disability rights plan, my transit plan, every plan that I have actually brings in money for New York State in the end. So if we're going to talk about cutting programs, I'm going to talk about passing programs, because every program that we pass is another dollar for New York State, and it's another life saved. Of course, if my back was against the wall, I would say we're not going to cut our healthcare programs, because those are the most important things in New York, because every dollar that we lose from those healthcare programs is one more person who's cutting their insulin pills in half. That's one more person who is not going to the hospital even though they have pain in their chest and then having a heart attack 3 days later. It's one more person who will die because we did not do the right thing. I do want to mention that my education plan works with the tax base, and it alters the way that our schools are taxed. It moves it away from property tax to a general tax across New York State, which I hope I get the chance to go more into later, but that would protect our educational tax base. Overall, we can pass programs and really make a big change in New York State.
Okay, Laura. Okay, now do it.
There we go. So this year, New York passed a $177 billion budget, but it's a revolving budget. It's not even a real budget. It revolves because we have no economy right now. We have folks that are not working, people aren't paying taxes. We have shut down our economy. So with this budget hole, no one can make promises that they're going to be able to get increased funding or not cut programs. So we have to restart the economy, but restarting the economy is going to mean that we're going to need additional help, right? So we have to follow the governor's criteria, but one of the things we absolutely have to do is get money from the federal government. It's crazy that we have McConnell in Kentucky saying that they're not going to bail out the blue states. That's absolutely ridiculous. But the priorities I have are, number one, human life is first. We have to get medical professionals, law enforcement, and essential workers the test and supply of PPE that they need. We're likely going to have to extend unemployment benefits. We have to get Suffolk small businesses the help they need so they can come back from this nightmare. And we have to get those 5% of New Yorkers into healthcare, get them preventative care as well. So, and also we have to address this tragedy that occurred in nursing homes. So many people have died. We have to understand and make sure that the next time something like this happens, we are totally prepared. And then, of course, after that, we have to make sure we don't lose the progress that we've made on addressing climate change damage and also prevention.
Okay, Nora Higgins.
Thank you. So as I had mentioned earlier, I think this is a great time to focus on healthcare and really push for no cuts to healthcare, but an enhancement to healthcare. And again, I agree with Tommy John. The education is important as well. We cannot, have our children, on a hope and a prayer that they're going to get educated at home while parents are working and juggling shifts amongst themselves. I guess I did hear the governor say that if he doesn't get his federal aid, he'll cut all state services 10%. And again, I would fight for that. State services, I'll make a little plug for my union, New York State Public Employees Federation. State services offer a vital component of care. I was speaking with a member earlier today who was working as a social worker at the Javits Center. And apparently a lot of the hospitals decided they were going to dump their most long-standing patients over to the Javits Center. And another hospital organization was seeing to it that these people get discharged without regard to their health, to where they, sorry, thank you, get discharged to an unsafe discharge. And there was my state worker saying that's unacceptable. He wasn't very popular, but people got placed where they should have been placed, and they were placed there safely.
Okay, Valerie.
Thank you. As a current elected official, I have been working very hard to make sure that we, as a result of the loss of revenue for the town of Brookhaven, that we're not having to either raise taxes at some point or lay off our employees. So I understand how traumatic it can be to lose revenue for a municipality. Prior to COVID, the state was in a deficit. They were saying a $6 billion deficit, and the governor had said that it can go up to $13 billion. And I get it. And the fact that we have not come to an end with this health crisis, we don't know how much more revenue is going to be lost. But I don't think it's unreasonable, even with the fact that we don't know when the end of this health crisis is coming, to say that there are certain things that just should not be cut. There should be no cuts to Medicaid. There should be no cuts to our hospitals, and there should be no cuts to our education funding. And you can say that if you know that there are other potential sources of revenue that you haven't tapped into in the past. So I think that the governor needs to be working very hard to make sure that he is taxing the wealthy. He's refusing to do so. And there are two pieces of legislation that are pending: the ultra millionaires income tax that can raise $2.2 billion per year. And then you have the billionaire wealth tax. So, and I'm sorry, the ultra millionaires is 650 million, and the pied à terre is 2.2 billion. So we need to just make sure that we are pushing the governor to make sure that he is taxing the wealthy so that everyone can be taken care of.
Okay, thank you all. And the last question before we do a closing. We know that COVID-19 is having a disproportionately deleterious impact on communities of color. At the same time, we see disproportionately high rates of discrimination and violence on people of color in New York and nationally. If elected, what will you do to advocate for immigrants and communities of color to right some of the imbalances and injustices we're seeing impact Black and Brown people? And we'll start with Skyler.
So every one of my policies takes that into consideration, how it will affect communities of color. When it comes to immigrants, I did bring up earlier that New York Health Act would benefit immigrants, because how the bill is written is it does not say every citizen of New York, it says every resident of New York. And because of that, your immigration status is not relevant for receiving treatment. So that's really important. As we all know, everyone saw the housing divided story that came out from Newsday. A lot of people were shocked by that. I personally was not shocked by that. As you can tell, I'm a man of color, and it was something that I've experienced myself. So when it comes to housing, my housing plan focuses on getting as many people into homes as possible with some of the vacant homes throughout New York State. I believe that a Black person in New York is 2 times more likely to be to experience this housing discrimination, to be to not be able to find a home in New York and to be forced out of New York because of that. So if we pass better housing plans, we're going to get people into homes and we're going to protect a lot of people. A lot of people of color are forced into unsafe housing situations where they're living with more people than they should, and that allows the virus to spread because of population density. So if we pass housing plans, we are going to get more people into homes. We're going to protect them. People will not have to live on the streets. They will have a warm place to come home to, and they'll have a place to practice proper hygiene standards, and it will protect a lot of communities of color.
Laura?
Could you repeat the question?
Sure. We know that COVID-19 is having a disproportionately deleterious impact on communities of color. Also, we're continuing to see disproportionately high rates of discrimination and violence on people of color in New York and nationally. If elected, what will you do to advocate for these communities and right some of the imbalances and injustices we're seeing impact Black and brown people?
Thank you. So what we've already seen is an effort to try to get testing and education into communities that are traditionally underrepresented, so that we could contact and trace, so that right away we can find out what the issue is that that Black and brown communities are more highly affected than Caucasian communities on COVID-19. So now on the issue related to discrimination and folks that have been treated inappropriately and crimes have been committed against them in minority communities, I actually sat on the county's hate crime task force. I was appointed by the Suffolk County Legislature because we run the county's crime victim center. So folks who were being targeted because of their race were experiencing serious hate crimes. So one of them was Marcelo Lucero from Patchogue. So after Marcelo Lucero was brutally murdered, he was literally hunted down and murdered in Patchogue. I was called upon to write the county's hate crime prevention and outreach program. So I wrote that program, and my staff go out into communities where there are day laborers, and we educate them about what their rights are under the law and what they're entitled to under the law if they ever become victims of crime. And then we also go into the schools and we educate kids about the serious nature of hate crimes, discrimination, and prejudice, and how that affects not only an individual, but the community as a whole.
Okay, thank you. Nora? Try again, just unmuted you.
3 times is the charm, it seems, every time. Alrighty. So as I've been a nurse, like I said, for over 30 years, and I've listened to, taken histories about people's diet and their activity and exercise and things of that nature. So it wasn't as though the COVID virus was particularly going after people of color, but I do know that we need to educate people on diet. Diabetes was one of the key things that attracted the virus to people. If we can start early, again, in the schools to educate about what a healthy diet is, to, work with the farmers and things to make sure that healthy foods are affordable for people. And also, I think we do need to have, pop-up healthcare establishments that signify that they are a safe haven for people. Just like the women who have babies that they don't want to take care of, they can go to these hospitals that have the little picture of a safe haven. We need a safe haven for, people of color who are afraid to seek health care, people of color who are afraid, or immigrants rather, who are afraid to get health care. That has been, and I'll tell you from working on the COVID unit, that has been a big problem. A lot of people who were immigrants, waited too long. They waited way too long to get the health care that they needed, and that was a crime.
Valerie?
Thank you. So it's clear to me that the reason why certain populations have higher COVID testing positives is because of it's directly linked to the systemic racism and the institutionalized racism that exists and is embedded in our housing and in our healthcare systems. We have to make sure that we do not miss this opportunity to be able to make change. We need to make sure that we're gathering as much data as possible. We need to be pushing the CDC. We need to be pushing the New York State Governor Cuomo to make sure that he's creating some form of a penalty if the testers are not including the race on the actual documentation and the information that they're gathering. A lot of things that have been pushed out are just recommendations. We need to enforce. We need to make sure that there is additional testing that is happening, and make sure that we're gathering and capturing all of that data. In addition, when we talk about other injustices that are occurring, a lot of the police brutality, we need to shift to a system where police are not policing themselves. In Suffolk County and Nassau County, they have internal affairs bureaus where they are policing themselves. Where you go into the city, you have a Citizens Advisory Commission. You need to have that on the island. We need to make sure that we are engaging in aggressive police reform, to make sure that there's proper training, to make sure that there's proper testing and screening before they become police officers. These are the things that we need to be focusing on with respect to reform in the next few years. Thank you.
Okay. Tommy John? Oh, hang on, sorry.
Okay. Can you hear me?
Yes.
Okay. Thank you for the question. What we're seeing with the COVID-19 in our Black and Brown communities is something that is systemic and that was already in place before the pandemic. Now we are seeing the effects of the pandemic and it's affecting these communities. A lot of the negative things that happen to our society happen, that are magnified rather, in our minority communities, whether it be climate change and other issues. They are getting it, they're getting it worse. Now the question was, what would we do? First of all, I believe that many people in these communities really do need healthcare. We need to increase our Medicaid so that everyone has healthcare. I firmly believe that, particularly in this pandemic, it has become vital that everyone go to see the doctors. I also believe that schools can be the key to this. I believe that we should move to a more community school model where people in the community can be enfranchised within the schools, and the schools become more than education. They become outreach in the community to provide healthcare, to provide information about doctors and political involvement, and helping these families get what they need. One of my priorities as senator also would be to make sure that we have affordable housing here on Long Island so that we can keep our young people here. We need those young people from all communities to be giving input, and their energy and their ideas need to be put into our economy so that we can move forward. Thank you.
All right, thank you. So I know this was, these were short windows of time to answer big questions. So we appreciate you making the effort. It's good to see a lot and hear a lot, through a number of questions. So we appreciate that. I think we have time for you to do 90 seconds. I think I originally said a minute. So 90 seconds of a final statement. And I'd encourage you to think about ways that you can differentiate yourself from the other candidates in your closing statement. And I believe we're starting with Laura.
Okay, am I good there, Catherine?
Good.
Okay, good. So this seat has not seen a Democrat since the early 1900s. It was Edwin Bailey from Patchogue. So whichever candidate you vote for, that candidate has to be able to beat the Republican candidate, right? And we already know that that's Palumbo. So who can beat Palumbo? So this Senate district is basically broken up into three large groups, one being Dem, one Republican, and one being Indies and Blanks. So I am a moderate Democrat. I am very well known throughout this county and New York State for my work in protecting children and with Megan's Law, and with helping our most vulnerable and social services out to the most needy. My experience, reputation, my name recognition, my message is going to resonate with those Indies and Blanks. Those are the ones we have to get. So, and even some of those Republican women. So the race is going to be highly contested and expensive, and that's the reality. It's going to cost money. I raised the most money, and I'm the candidate who out of the candidates who filed the report. I have a very strong campaign. I have a 20-year track record of delivering and with working with a very wide and diverse base of support from the community. I have an endorsement from the Suffolk County Presiding Officer of the Legislature, Rob Clarko, the Deputy Presiding Officer, Ahearn, Kate Browning, the former Chairwoman of Public Safety, the men and women in labor, including the steam fitters, Local 25,
That's time.
a whole bunch of unions. And they've begun their narrative, and they're characterizing us as Long Island Senate Democrats
That's
advancing
time.
New York City agenda. So I just can only humbly ask for you to consider me, that I believe I'm the only one who could beat Palumbo.
Thank you, Laura. Nora Higgins?
Yes, hi. You can hear me this time? Yes?
Yes, yes.
Okay. Alrighty, so I believe we do need a better Long Island, and particularly in District 1. Again, I said I have 4 children, 4 stepchildren, 7 grandchildren. None of my children want to stay here on Long Island. None of them feel that there's anything here for them. They feel it's too expensive and just not doable. What I offer is vocational diversity. I am not a lawyer. I am someone who works hard. I get the job done, and I will be advocating for the people who are healthcare, people who are labor, people in the education department. The average resident should not be forgotten. We need to fight for those. Many of the laws that get passed seem to cater to the rich, and it's so unbalanced that that is criminal as well. So again, the 2020 is the year of the nurse, and I am a frontline healthcare worker. Let me be your hero.
Thank you, Valerie. Cartright?
Thank you. So over the past few weeks, working as an elected official and representing my constituency through this turbulent time, it's made me realize how important. I knew it was important to have an advocate and a passionate person that works for the people in a state Senate seat. However, now it's only been magnified. Each and every day, I'm fighting for my constituents to make sure that their needs are met. And we need to make sure that we are putting someone in office that has real life experience, that understands the struggles, but also has experience as a legislator. And I have 7 years experience as a legislator, and has experience advocating. And I've been advocating, as I indicated previously, for all of my life, but have been advocating from the perspective of an attorney for over 18 years. So I think it's important that we recognize the experience and the skills that are being brought to the table. I am looking to fight for not only the state Senate district, but for all of New York. We have a Democratic majority that has pushed forward reform that we have never seen before. And we need to keep that going if we want to make New York the New York that we continue to be proud of. So I distinguish myself because I'm the most experienced and have the most legislative experience here, and understand the importance of keeping and increasing the Democratic majority.
That's time. Thank you.
Okay, thank you. Tommy John?
Thank you, Chairwoman, and thank you to the South Hold Democratic Committee. And I really appreciate you doing this. Now, as far as differentiation, I am from Senate District 1. My entire life, my family were raised here. I spent my career in Senate District 1. I am from a large family in Sag Harbor, and my father was a plumber, as my grandfather was. I was raised in plumbing. As far as any other senator in the state of New York, I believe that I will be the only commercial driver with a hazardous material certification. In addition to being a plumber, I also have my college degree from SUNY Cortland, my master's from SUNY Stony Brook, 30 years teaching experience in the Santa Maria School District, an adjunct instructor from Syracuse University, as well as Suffolk County Community College. I understand construction. I understand what it's like to live here and can get an education here and raise my family here. My children are going to public school in Senate District 1. I have seen the families in this Senate district, and I know what they're going through. I know what their challenges are. I am an elected official in the town of Southampton. I have been in government for over 12 years. I'm a police commissioner, a fire commissioner, town board. I was on a zoning board of appeals. I was the head of a youth center. A variety of things that I have done in government, in municipal government, in schools. In addition to that, I have been to Albany. I have fought for public education funding
Thank you.
as a school board member and a teacher, and I want to thank you again.
Thanks. And Skyler.
So thank you, Catherine, and thank you for everyone that came today. It's funny because something that's always taught to you when you're younger is, just do well in school, go to college, get a good job, and you'll have a good life. That's what I was taught when I was really young. And then the financial crisis hit. That's one of the earliest things that happened in my life because I am young. However, the entire world turned inside its head. And the younger generations realized that they were inheriting a world that was worse than the one that their parents had. And the older generation started to lose everything that they had. I can work to fix that. We have this misconception in politics a lot that if you walk and talk like the other party is going to vote for you. Walking and talking like a Republican is not going to get anyone votes this time. We are in a hyper-partisan year. The only way to get people over to your side is to have the policy to do that. My policy for the environment, my policy for clean water does not just appeal to Democrats. I've spoken to Republicans out in the Hamptons or out here that are concerned about their water quality, and they're going to cast their vote for me because I told them exactly how I'm going to get them better water quality. So just before I end, if you want to learn more about me or read some of those policies, please check out skylerforsenate.com. I've been written up in articles and everything from local papers to MTV to city and state. I've been showcased nationally, and I'll be able to appeal to voters across the district and get people out to vote. And I hope you'll join me at skylerforsenate.com. Thank you.
Okay, thank you, Skyler, and thank you to all the candidates for joining us this evening. We know that yeah, I see people clapping. We know that we barely touched upon many of the important issues that could have been discussed this evening. So to Skyler's point, we encourage you to spend time on the candidates' websites and looking to learn more about their positions on other issues that weren't touched on this evening, including water, environment, climate change, education, and much more. Also, I'm sure I'm not speaking out of turn when encouraging you to get in touch directly with the candidates. They want to speak to voters, and especially informed voters such as yourselves, to help convince you to vote for them. So feel free to reach out to their campaigns to learn more about them. I also want to remind everybody they should be receiving an absentee ballot application form in the mail very soon. Please make sure to complete that form and mail it back so that you receive your absentee ballot so that you're able to, oh, look, Sarah Napa, town councilwoman, has it right there. Well done, Sarah. So please do be sure to do that so that you can vote. And we have here this evening our most informed voters. So pat yourself on the back. Congratulations. You are the best of the best in terms of informed, educated, active, proactive voters. And that also comes with a real responsibility. And your responsibility is to reach out to your friends, your neighbors, your family, to remind them to vote on the primary on June 23rd. Primaries often have a relatively low turnout, and that is something that we are dedicated and even changing. Thank you so much. I see somebody else showing their application form. So please, please, please tell friends and neighbors about the June 23rd primary, that it is still on. I know there was some confusion about that in the news. The primary is still on, and make sure that your friends and neighbors know about how to get their application form. If they don't receive one in the mail, they can also go to the Suffolk County website, print the form, and mail it themselves. So there is more than one way to get that. Then the more we can do to educate people, the better a democracy we are, right? So thank you all once again. Enjoy this beautiful evening, and all the best to everybody.
Thank you, everyone. Thank you.
Thank you, everyone. Thank you, Kath. Great job.
Stay safe, everyone.